Okay, so in this video, we're going to go over two different mnemonics that we went over in class. The first one is going to be torch, which are the maternal infections that can lead to congenital defects in newborn. And then we're going to go over Gtpal, which is another mnemonic that we had used in order to um, just give information in regards to how many babies the mother has had, how many, we'll go over that. But they're just two mnemonics that I really wanted to touch over, which were a little difficult for me to remember, so I wanted to make a video on them. So the first one that we're going to go over is the torch mnemonic. Now, these are infections that a mother can have that will cause birth defects or congenital defects in newborns. So we're going to go through each and every one of this. It's a little bit different. I did a little bit different with the O than class had done. So this is just something that made it easier for me. So the first infection is going to be toxoplasmosis. Now, this is a infection that can be gotten through typically through cat feces, which is why it's suggested for mothers to not change the litter box. So that's a good excuse for the mom to not have to do that. But also anywhere cat feces could be found. So if there are feral cats or cats outside, could be in the garden as well. So you got to be careful about that. You can also get it through raw meat or unpasteurized goat milk. Those are also two less common ones. So key thing about toxoplasmosis is it's going to be transmitted for life. And there's the problems that it has with the babies is retinal problems. It can lead to like inflammation of the retina, which can lead to permanent blindness. That's probably the most common complication for toxoplasmosis. And then for the O, we're just going to put other because there's two separate ones that we want to talk about in this section. And that's just the mnemonic that they had. So we're going to be talking about two, which is going to be parvovirus B19 and varicella zoster, which is chickenpox. So the first one we're going to talk about is parvovirus B19, different than the parvo that you get in animals. Um, and this is like what they refer to as slapped face rash. So it looks like a newborn or a young child would be slapped in the face, kind of like redness around the cheeks. It's not necessarily like a handprint, but if you look at pictures on it, it's just like red cheeks on both sides, or it could be one side. This can lead to anemia in infants. So we're going to put anemia, which can lead to jaundice. So if you see a newborn that's jaundice, that is one of the things that we should be testing for because it could be an infection with parvo. And the anemia, and then also for heart failure or CHF, which can also lead to the jaundice as well. And then we have varicella zoster, which is your chickenpox. Now, this is a super important one. This is a life-threatening emergency. It is a airborne virus with severe respiratory symptoms. So severe difficulty breathing, a lot of congestion, a lot of inflammation. This, as we said, is a medical emergency. The reason being is there's a lot of different things that can happen. You could have a miscarriage or spontaneous abortion. Uh, uh, so placental abruption, it could be brain dysfunction. And then there's one more that was super important that I forget. Limb malformations. Just put limb issues. That's where you see a child with either like a, for lack of better terms, like a stub, not fully formed. So it's super important to be treated for that. Next is the R, which is rubella or German measles. Now, the key thing about this, and it is another airborne virus as well. As we talked about in class today and then last week as well, is that it's really important that we vaccinate mom after she gives birth. So we're not vaccinating during birth, it's after birth if she hasn't had either exposure to chickenpox or if she hasn't had any sort of vaccine for that. So what happens with rubella is, I'm sorry, yeah, with rubella is deafness, could be, this is pretty much for all, kind of affects all areas. So it could be CNS issues. What was the other thing they said? Eye, heart defects. And then we'll start here. Vaccinate after birth. Because we're not going to do it while she's pregnant. And then the C stands for cytomegalovirus. This is another one that's super important to know. So for a mom, it doesn't have any consequences. Like mom might not notice, she might not even have any signs or symptoms. However, it is fatal for the infant. It is a type of asymptomatic herpes virus, and most important risk is exposure to children. So like children that are in daycare. Important risk is exposure to children. And it is fatal, once again, for the infant. And then we have the H, which is herpes simplex virus, which, as many of you know, is, there are active lesions. You could also have like a cold sore. The greatest risk to the infant is going to be during the third trimester. The reason being is if there's an active lesion, that's where the transfer would occur. So if you do have, if a woman or a patient does have herpes simplex virus, we will treat this. This is treatable. So we're going to treat via acyclovir. And I think it's the last 4 weeks. Yeah, in last 4 weeks of pregnancy. And that will hopefully get rid of any sort of active lesions. If there is an active lesion present, this will equal a C-section. That is non-negotiable. The reason being is that, once again, the active lesion will cause transmission to the fetus. It's not transplacental after, it's not transplacental, so you can't get it through the placenta. It's only during birth with an active lesion. So these are once again, the infections that cause any sort of congenital birth defects. Super important to know. And then this next acronym, sorry, it's a little longer video, but this next acronym or mnemonic is going to be for just different things that we use to not assess the mother, but just to see what kind of background history they have with pregnancies in the past. So Gtpal is, I forget this also. So we have gravida, number of term infants. Let me put this here. So G is for gravida, which is the number of times the mother was pregnant. Now this is the number of times that you're pregnant. So if you are pregnant with twins, that is technically one pregnancy. And we will understand that a little bit later on when I go over the next thing. So gravida is the number of times that you're pregnant. T is for term, which is the number of term infants. Now this is whether or not they are viable if they're born, if it's a stillborn, it doesn't matter if it's a live birth, it doesn't matter. Term infant, which is 37 plus weeks. And then we have P, which is preterm, which is the number of preemies, which is going to be less than 20 weeks. sorry, preterm, less than 20 weeks. Oh my goodness, my apologies. Greater than 20 weeks, less than 37 weeks. And that's for viable babies as well. A is then for number of abortions. Number of abortions. Now this counts for both miscarriages and for elective or therapeutic abortions. So we don't say miscarriage as we talked about in class. We don't say miscarriage, but we say abortion, whether that's spontaneous or therapeutic. So spontaneous, or we'll just say medical. Make it a little bit easier to write there. Number of abortions, regardless of what type. And then L is the easy one, living, which is the number of living children. A lot of times this is going to be used to kind of give you a little estimated idea of how she's going to do during pregnancy. If she's had abortions in the past, that's going to interfere with her pregnancy or possibly any further births that she has. If she's had preterm babies in the past, she might be more susceptible to having a preemie, and it just gives you a better idea. And then you have the gravida pair, which we talked about in class. But those are, oops, that's going to be it for me.